Comprehensive Assessment of Communication Domain. In CHC assessment. Can the individual effectively send and receive verbal communication, and is this consistent throughout the day? Is English their first language, and if not, do they require support, such as a translator, interpreter, or communication cards? Is their verbal communication reliable, or do they experience difficulties in expressing their thoughts, emotions, and needs clearly? Can they engage in a full conversation, and if so, is their communication coherent and contextually appropriate? If they can only respond to yes or no questions, are their responses reliable and meaningful, or do they provide inconsistent answers? Do they experience any cognitive impairments that impact their ability to understand, process, and express information effectively? How does cognitive impairment specifically affect their communication skills, such as memory, comprehension, or word retrieval? If verbal communication is unreliable, are they able to use alternative methods such as gestures, facial expressions, writing, or assistive technology? Can their needs be anticipated by carers if they are unable to communicate effectively? On their own, do they have sound nonverbal communication skills such as gestures, facial expressions, pointing, or eye contact to convey their needs and emotions? Can carers accurately interpret and respond to their nonverbal communication, ensuring that their needs are met appropriately? Do they require a communication aid such as a letterboard, picture cards, electronic speech device, or sign language to facilitate effective interaction? If a communication aid is used, is it appropriate for their level of ability, and are they able to use it effectively? Do carers need to assist in interpreting or anticipating their needs due to limitations in verbal or nonverbal communication? Are all their needs fully anticipated by carers because they have no reliable form of communication? Does the individual have any physical impairments, such as hearing loss, speech difficulties, or vision loss, that impact their ability to communicate? If there is hearing impairment, is it partial or complete? And do they use a hearing aid or require other assistive devices? If there is vision impairment, how severe is it? And does it impact their ability to read, recognize faces, or interpret? Nonverbal cues. Do they struggle with understanding spoken language due to sensory processing difficulties, auditory processing disorder, or neurological conditions? Are they able to follow simple instructions? And do they respond appropriately to direct questions or commands? Do they require prompting or repetition to understand and respond appropriately in conversation? Are they able to express discomfort, pain, or distress verbally or non-verbally? And can carers accurately interpret these signals? Have they been assessed by a specialist, such as a speech and language therapist, SALT, or audiologist, to determine communication needs and interventions? Have any specific recommendations been made by specialists regarding communication support? And are these strategies being followed? Are they able to use written communication, such as writing or typing, to express themselves if verbal communication is impaired? If they use written communication, do they require assistive technology, such as a tablet or communication software, to support their needs? Are they able to recognize and respond to familiar voices, sounds, or environmental cues that aid in their understanding and interaction? Is their ability to communicate affected by fatigue, stress, or medical conditions that cause fluctuations in their cognitive or verbal abilities? Have there been any changes in their communication abilities over time? And if so, what factors have contributed to these changes? Do they exhibit frustration, anxiety, or distress due to difficulties in expressing themselves or being understood by others? Are there specific strategies or interventions in place to support their communication, such as structured conversation techniques or sensory-friendly environments? Is there a communication care plan in place that outlines their specific needs, preferred methods of interaction, and any necessary adaptations? Are carers trained in effective communication strategies that are tailored to the individual's specific difficulties and strengths? Does the individual's communication ability impact their ability to engage in social interactions, relationships, or daily activities? Are there any risks associated with their communication difficulties, such as misunderstandings, inability to express urgent needs, or social isolation? Has there been input from family members or close contacts to determine the most effective ways to communicate with the individual? Is there ongoing assessment and monitoring to ensure that their communication needs are met and that appropriate? Interventions are in place. Are there any additional external supports, such as speech therapy, assistive technology services, or community-based communication programs that could improve their ability to communicate? Does their communication ability impact their overall quality of life, independence, or ability to express choices and preferences? Have efforts been made to encourage and facilitate their communication abilities, including engaging them in conversation, providing structured opportunities to communicate, or using technology to support interaction? Please share your thoughts in the comment section.